You see people walking down the sidewalks and they have their mouths open. They
Right.
don't need to. They're not doing
Right.
much physical exercise, and even they will be out of breath. And, that gives you a telltale sign. These people are breathing hard and fast with minimal physical exercise. They are in pretty poor shape from a breathing point of view.
It isn't about being perfect. It's about being better. Hello, my name is Dr. Stephanie Stima, and I host expert discussions with thought leaders in all facets of health, including nutrition, fitness, hormones, stress management, performance, recovery, longevity, health span, and energy production. On this show, we discuss complex science, but then we also alchemize it into actionable, everyday living. The ultimate goal with the show is to assist you in making informed decisions about your health and to catapult you into being the hero in your own life. Hello and welcome to another episode of Better with Dr. Stephanie. It's me, your host, Dr. Stephanie Stima, and do I have a treat for you today? We are talking all about breath and how women breathe differently than men. Oh yes, yet another way that women are not little men with pesky hormones. In fact, we talk about the relationship today with breathing and hormones through the menstrual cycle, perimenopause and menopause. And my guest is Patrick McKeown. He is a world-renowned breath expert and founder of Oxygen Advantage. It's a training program used in over 50 countries, more than 3,000 certified instructors to improve sleep, anxiety, focus, resilience, and athletic performance through functional breathing. Since 2002, Patrick has authored 10 books, including The Breathing Cure, The Oxygen Advantage, which has been translated into 16 languages, and several Amazon bestsellers like Close Your Mouth and Anxiety Free. He is a fellow of the Royal Society of Biology and member of the Academy of Applied Myofunctional Sciences. His work has appeared in the Journal of Respiratory and Critical Care Medicine and has been featured by the BBC, the New York Times, Men's Health, and more. He hosts the podcast named after his bestseller, The Oxygen Advantage, and is a frequent guest on top podcasts like this one. And so Patrick today, he and I went on a little, we'll call it geeky magic carpet ride, a little nerd safari on breathing. And we talk all about how women are different than men in terms of both our biochemistry, our biomechanics, and our psychophysiology. So this is a very interesting discussion. If you are somebody who's ever suffered from PMS or you've had a difficult second half of your menstrual cycle, Patrick explains how the breath and our carbon dioxide tolerance may be contributing to some of those symptoms. We also talk about the transition into perimenopause and menopause and how the loss of some of our reproductive hormones can also change our lung capacity, why many of us begin to snore, the different types of snoring, mouth breathing versus nasal breathing. Like, this is such a great episode. And of course, I hope that you get a lot out of this conversation. This is a conversation I have never heard, even just in prep for my conversation with Patrick today. I don't think anybody has focused in on females and how we breathe differently. So please enjoy this conversation on women and respiration with Patrick McKeown. All right, Patrick McKeown, welcome to the Better Podcast. I am thrilled to welcome you today.
Pleasure. Thanks very much, Stephanie.
We are going to be talking all about breathing. And I thought for this audience, for my Betties on the Better Podcast, I thought we might just jump right into how breathing is different for women. This is something that has been known for a long time. And of course, research is really sparse. And I would love for you to expand on, first explain how the breathing is different for women. And then we can sort of get into some of the nuances around menstrual cycle irregularities and perimenopause and menopause. But let's start off with how breathing is different for women.
Yeah, of course. I suppose to answer that question, we have to look at the different dimensions of breathing. And when we think about breathing, very often people think about the diaphragm, and that takes a lot of attention. But there's three main dimensions to breathing. You have the biochemical dimension, which is focusing around carbon dioxide and the body's sensitivity to that gas, which ultimately, of course, carbon dioxide is the primary driver to breathe. And I will come back to that. And also then we have the biomechanics, and we have airway itself. And then we have the psychophysiological aspect, which is the mind-body connection. So whenever we think about our everyday breathing patterns, we need to look at it from those three different perspectives. Now, in terms of female breathing, it's been known since 1915 that women hyperventilate during different phases of the monthly cycle. So, for example, menstruation, then there's the follicular phase, proliferation, ovulation, and after ovulation and mid-luteal phase, there's an increase in progesterone, there's an increase in estrogen, and progesterone is a hormone that stimulates breathing. So breathing during that time, mid-luteal phase, is going to be a little bit faster and possibly a little bit harder. And that in turn then causes a lowering of the gas carbon dioxide from the lungs because we breathe out too much of it. And that in turn then reduces carbon dioxide in the blood leaving the lungs. And when carbon dioxide leaves the blood, is lower in the blood vessels constrict, so blood vessels narrow. And there's also reduced oxygen delivery throughout the body based on what's called the Bohr effect. So if you think of, say, a female, and say she has not particularly good breathing anyway, but post-ovulation, mid-luteal phase, now she's got an increase in progesterone, which is stimulating her breathing. And now she's got an exaggerated breathing response on top of her already relatively poor breathing. This can lower carbon dioxide by as much as 25%. And that's huge because that in turn would reduce blood flow to the brain, for example. That would increase anxiety. That would increase panic disorder. That would contribute to fatigue. And there's a host of different symptoms associated with chronic hyperventilation. And see, the thing is, it's not obvious. It's not that she's having a panic attack in front of us. Like that's the kind of extreme ends of the scale. It's just that her breathing is a bit faster and a bit harder. And it seems to be the women with the increased sensitivity to the gas carbon dioxide that has the most pronounced change in their breathing patterns. And they also, in a very, very understudied area, also seem to have the most PMS symptoms. So, in other words, there could be a connection between the symptoms of premenstrual syndrome and hyperventilation, in that the symptoms cross over. And then one begs the question, well, what about if you controlled your breathing? What about if the female was aware that she could be likely to be hyperventilating or breathing just a bit faster and harder at this point? She might be feeling air hunger. She might be feeling that she's not getting enough air. And of course, if you're not thinking about your breathing, you'll kind of naturally respond by taking a few bigger breaths. But that doesn't do anything to help the problem. Yes, it gets rid of air hunger, but it also gets rid of the gas carbon dioxide. And that's the very thing that we want to address. So I think it could be very interesting. We've seen it with our instructors over the years as well. Their breathing may be pretty okay during menstruation, the follicular phase, proliferation, ovulation, and then mid-luteal phase. Their breathing does get that bit faster and harder. But it depends. It's going to vary female to female. But if a female is kind of paying attention to her breathing, in line with the phases of the monthly cycle, she may pick up that there's a connection there.
So you mentioned if she's not breathing well, and I don't think that we have parameters around what that looks like. So can you define what good breathing might be for the listener?
Sure. If you were to assess it with validated scales, so for example, I said there were 3 dimensions without complicating it. The biochemical dimension is the sensitivity to carbon dioxide. Now, that has huge implications for females and men. Because if we are overly sensitive to the accumulation of this gas, which we produce internally anyway, and it's not true that we breathe out the waste carbon dioxide, we only breathe out about 15% of what the body produces. Carbon dioxide itself serves a number of very, very important functions in the human body. But if we have poor breathing from a biochemical point of view, we will have a low breath hold time. So, for example, we use a test. One from the Buteyko technique is called the control pause. And the other then from Oxygen Advantage, it's a similar test. It's called BOLT, Body Oxygen Level Test. Now, all that involves is that she sits down for, say, 2 or 3 minutes with normal breathing, in and out through her nose. And then she takes a normal breath in through her nose and a normal breath out through her nose, pinches her nose and stops breathing, and times it in seconds. How long does it take until she feels the first definite desire to breathe? Or how long does it take until she feels the first involuntary contractions of the diaphragm? Now, an easier way to think of it might be this. How long can you hold your breath for after a normal exhalation and still have normal breathing when you resume breathing? So where would you like to be with that figure? It should be in around 25 seconds. If you're above 25 seconds, it indicates functional breathing. If you're below 25 seconds, it indicates dysfunctional breathing. Now, here's an interesting connection. Your length of breath hold time is an indirect measure of your sensitivity to carbon dioxide. And there is a connection between the sensitivity of the carbon dioxide and the autonomic nervous system. So the connection there is that if you have a strong chemosensitivity to carbon dioxide, you have a low breath hold time. So if you have a low breath hold time, it indicates you have a strong sensitivity to carbon dioxide. But there's also the connection in terms of if you have a strong sensitivity to carbon dioxide, you have reduced sensitivity of the baroreflex. And that also would feed into an autonomic nervous system that's in an increased stress response. So we do see a connection between breathing patterns and breath hold time and heart rate variability. And that, of course, is going to have implications as well, right across the board, both male and female. But I think really with females, because, even though I said that females breathe differently, which they do, I've only pointed so far on the biochemical dimension of breathing. Females have smaller airways than men. Now, I think where it's got two implications. One is during physical exercise. If you've got a smaller pipe, so I'm talking about the space at the back of the nose where it meets the throat, and the throat itself, so at the back of the mouth where it meets the throat, and then the throat itself, just to keep it simple. If that pipe is smaller, there's an increased resistance to breathe. It takes more effort to breathe. You have to work harder to breathe, and that has got implications during physical exercise. And another aspect then is, of course, the airway is very important during sleep, and females are very susceptible to what's called upper airway resistance syndrome. Now, you could spend all day talking about this condition, and even back as far as 1995, the founding father of sleep medicine said that women were the forgotten gender when it comes to sleep. Now, it's not that I'm going off on a tangent. There is a connection between sleep and breathing and the autonomic nervous system. Depending on the age of the female, it's going to have application.
All right, so let me just recap what you said there. So if we are doing that whole test, let's say, so you breathe in, you breathe out, you hold your nose, and we're trying to get to 25 seconds or above. If someone's listening and they do that and they are not able to get to 25 seconds without having to take in, huge amounts of air afterwards, is that person going to be more susceptible to some of the symptoms that we see in the cluster of PMS? So more anxiety, maybe more sleep disturbances, more mood and affect changes, even changes in digestion and bloating and inflammation. Is that person at a higher risk for that? Or is there a direct corollary there?
There seems to be. It's very understudied. The only paper that I can find that really looked at that in detail was a 2006 paper. So try one 2006 paper, and it's just looking at 3 cases. And the researchers looked at these 3 individuals with severe symptoms of PMS. And they found that all 3 women had a heightened sensitivity to carbon dioxide. So that pretty much means that those women are going to be hyperventilating. And if you hyperventilate over a period of time, it really has an effect on the body. The symptoms you described there, but also stress, anxiety, panic disorder, headaches. Because if you think about, if you're breathing a bit faster and a bit harder than what you should be, your 50,000 miles of blood vessels are narrowing. But it's not only your blood vessels narrow. What also happens is that when you're blowing off too much carbon dioxide from the lungs and reducing it in the blood, hemoglobin then holds onto oxygen too strongly and doesn't release oxygen so readily. So there, for example, you could have a female then, and maybe she's prone to the symptoms of fibromyalgia. And fibromyalgia is a syndrome with different symptoms, and part of that can include pain, for example. So she goes for a walk, and during that time she's hyperventilating. It might be only a 20-minute walk, but then when she has to go back to bed because she's such an increase in lactic acid. See, if you hyperventilate, it doesn't mean that there's more oxygen getting to the working muscles. It means that there's less.
Less
Oxygen. That's the thing about breathing as well, Stephanie. Like, people have an idea about breathing that the more air you breathe, the better. That's not true. It's the same as water. It's the same as food. It's pretty much the same as anything with a human being. It's all about balance. And I think most people on the face of it, they realize that, yes, there has been a time in their life that, yes, they were taking these full deep breaths. They were taking big breaths. They might have been slowing down their breathing, but they were feeling lightheaded as a result. That's not a sign that there's an increased oxygen and blood flow in the body. That's a sign that's the opposite.
And so when we think about some of the things that may be cyclical for the menstrual cycle, so things like migraines, even individuals with asthma sometimes will report, the luteal phase versus the follicular, like different, symptoms or even just severity of asthma attacks or wheezing and coughing. Can we see those things? Is there like a predictable pattern that we can see over the course of the menstrual cycle then with some of these things that are seemingly unrelated, right? It's like, how is asthma related to, my menstrual cycle? But we can sort of pin that, or we can relate it to the way that the individual is breathing and whether or how sensitive they are to the carbon dioxide.
Oh, totally. Absolutely. I came into breathing primarily because of lifelong asthma. I was 26 years of age at the time. I found out about this technique a Ukrainian doctor had developed called the Buteyko method. I started putting it into practice. Made an enormous difference to my asthma. The problem with my asthma was, and with anybody's asthma, when you have airway narrowing, you feel that you're not getting enough air. And whenever you feel that you're not getting enough air, it's natural to start breathing a bit faster and a bit harder to try and alleviate that sensation of air hunger. But all that does is contribute to a cooling of the airways, a narrowing of the airways. You're bypassing the nose generally, so you start breathing through the mouth. You're taking unfiltered, unconditioned air directly into the lungs. You're also bypassing the nose, so you're not harnessing nasal nitric oxide. Nitric oxide is a natural bronchodilator. It helps to open up the airways. So in other words, the poor breathing pattern of the person with asthma is not just because of the asthma. The poor breathing pattern is actually feeding into the asthma. So, that female is going to have asthma anyway. But what she's having is a spike of symptoms as a result of the increased breathing, which has been driven by the increase of progesterone, the change in hormones. Headaches, migraines, very understudied as well when it comes to hyperventilation, but there have been some papers on it. If you reduce your breathing volume, you can increase blood flow to the brain quite significantly. This was my talk at Health Optimization Summit, because if you think about breathing, the two vital organs in the human body, being the brain and being the heart, how can we, or what function of the body influences those directly? Is it your diet? Is it your physical exercise? Is it your sleep? Or is it your breathing? And the answer is your breathing. It's not just that I'm going to be biased towards it. But if I put it this way, if I was to breathe less air, and what I mean by this is just taking a shorter breath of air into the nose. So taking in about 70% of the breath into the nose, and allowing a really relaxed and a slow and a gentle breath out, to the point that I'm breathing less air. And I know that I'm breathing less air if I feel air hunger, or if I feel that I would like to take in a deeper breath. And that indicates that there's an increase of carbon dioxide in your lungs. Now, if you continue breathing less air over the course of a minute or two, you start to increase blood flow to the brain. And if you breathe less air to the point that you have a tolerable air hunger, it would indicate that your carbon dioxide in the lungs and blood will increase by about 3 millimeters of mercury pressure. And every 1 millimeter mercury pressure increase will increase blood flow to the brain by 3 to 4%. So you can increase blood flow to the brain by up to between, say, 5 and 10% within 1 to 2 minutes. Not by taking full deep breaths, not by breathing harder and faster, but by breathing less. And this is the secret that is being overlooked when it comes to breathing. And the reason being is because there's nothing for anybody to see. There's nothing for anybody to hear. And very often in the Western world, what captivates attention is when the loudest and the most visible gets the attention. So, if you think about somebody who's just gently softening and slowing down their breathing, it almost appears as if they are doing nothing, but yet the effect of that is very, very profound. And also, if the female was to practice that, she helps then to reduce her sensitivity to the accumulation of carbon dioxide. So as a result then, with a reduced sensitivity to carbon dioxide, we would expect to see a reduction of the symptoms, PMS, especially if those symptoms are connected with hyperventilation. I think it's very, very important that we all have some control over our breathing. Like, I'll give you this example in an everyday setting. I was listening to a podcast by Dr. Rangan Chatterjee. He's very big over here at this side of the world. And he was interviewing a brain surgeon called Dr. Rahul back about 3 years ago. And Dr. Rahul, you can imagine the stress that he could be under if things go wrong as a brain surgeon. So Dr. Rahul said, if I get into a tricky situation, the first thing I do is prevent myself from hyperventilating. And I was just listening to this and I said, of course, he's a brain doctor. He knows the connection between hyperventilation and how it can tip us into the fight or flight response. He knows the connection between hyperventilation and the brain and blood flow and oxygen delivery. It's just normal physiology. So how do you then prevent hyperventilation? Anytime I go into a challenging situation, and it could be giving a talk as we did last week or the week before, and if I start to feel my heart rate getting a bit faster, I want to bring down this heart rate. I don't want to go into a talk or I don't want to go into a meeting with my breathing being faster and harder, because all that's doing is telling my brain that I'm not safe. And my brain, if it interprets that the body is not safe, is going to put me into a fight or flight response, and that's not going to be a time for delivering a good talk. So how then do I prevent that? I could be standing just outside the door prior to going out on stage. And all I do is bring my attention onto my breathing. And I take a soft breath in, almost an undetectable breath in through the nose, and a really relaxed and a slow and a gentle breath out. And even if I do that for 30 seconds, I can bring down my heart rate. I can also use the technique to put the critical mind aside, and I can walk out on stage, walking out with every cell of my body and speaking from every cell of the body and not speaking from the head. So I think it's a tremendous tool that when we start paying attention to our breathing, and it's not just a breathing technique for when we have a challenging situation, like coming back to the female who has symptoms of PMS, what about if she improves her everyday breathing pattern? And the foundation of improving your everyday breathing pattern starts breathing in and out through the nose. Not breathing in through the nose and out through the mouth. That doesn't make sense. Not breathing in through the mouth or out through the mouth. Again, that doesn't make sense. If we look at what's inside the mouth, on a very simple level, we have our teeth, we have our gums, we have our hard palate or soft palate, we have the back of the throat, we have saliva. You haven't a whole lot more in there. We have our tongue, of course, if I haven't already mentioned it. If we look at what's in the mouth, everything inside the mouth is for eating, for drinking, for speaking, and for social bonding. And that's it. There's nothing inside the mouth for breathing. The mouth wasn't designed to breathe. Whereas the nose has everything when it comes to breathing. And the nose has a minimum of 30 functions. I've collected over the years 31 functions which the nose can do, which the mouth doesn't do. And if that female is going around, even during her light physical exercise with her mouth open, it doesn't make sense. Mouth breathing, you're breathing faster, you're breathing harder, you're breathing more upper chest, you're more likely to put yourself into an increased stress response. Mouth breathing during physical exercise can cause hyperventilation if the person has poor breathing, and this can be reducing blood flow and oxygen delivery throughout the body, including the heart and including the brain. And a more recent paper that was written by Professor George Dallam, he looked at endurance athletes and he looked at their heart health, and he asked the question, why could these athletes, these people are healthy, they're doing a lot of physical exercise, they're doing a lot of mileage, they're doing a lot of running, why do they have poor heart health? And he put it down to, yes, they have their mouth open, they're breathing hard and fast, they're exercising their heart, they're working their heart, but they're also reducing blood flow to the heart during that time, and that could be contributing to scarring of the heart muscle, fibrosing. So he said, could nasal breathing, by breathing in and out through the nose, it restricts your breathing volume. You initially feel air hunger that's stronger. That indicates that there's an increase of carbon dioxide in the lungs and blood. So when you do physical exercise with your mouth closed, you've got increased carbon dioxide in your lungs and blood, and you've got improved blood flow throughout the body, including the heart. So the heart is not just a muscle for pumping blood throughout the body. The heart also needs its own supply of blood and oxygen delivery. And if we have our mouth closed versus our mouth open, That's two different scenarios. And that's just one function. We were talking about asthma earlier. We can talk about anxiety. A person who does their physical exercise with the mouth closed, they also have increased blood flow to the brain and oxygen delivery. And that in turn can reduce brain cell excitability. I find that interesting because I wrote a book back in 2010 called Anxiety Free. And it was about bringing mindfulness together with functional breathing. I often felt that people who needed help the most would find mindfulness most challenging. And mindfulness is often put out there. And I think mindfulness is a tremendous tool. But if you have an individual with poor sleep, they naturally have increased rumination of the mind. If you have an individual who is in a state of chronic hyperventilation with an autonomic nervous system that's likely to be in an increased stress response, increased sympathetic drive, they also will have increased rumination of the mind. Now, that's very common. 8.4% of the US population takes sleeping pills. That indicates that there is rumination of the mind. They have difficulty slowing down. And this affects more females than men. Insomnia way more affects more females than men. But because, and I don't want to go off again, and because I have a tendency to do that. But my point here is, if you're doing physical exercise with the mouth closed, you're going to get so much more out of it than just a training for the body. You're also get a training for the brain, but also a training for your breathing. So if somebody was to say, well, I can't be just doing more breathing exercise, I've no time, you don't have to. I want to make breathing more accessible. I don't have time. I did 20 minutes of formal breathing today with relaxation as a rest and reset. I did an hour of physical exercise this morning. I did about 30 minutes just kind of elliptical movement with my mouth closed. That's my breathing exercise. But I also use it as a training for the brain. I think we need to harness breathing in a way to make it accessible. It's not just something that you do while you're on the yoga mat. It's not just something you do in a particular setting. But really the question is, how are you breathing during different activities throughout the day?
Okay, so let's build on that. This is going to be both for women who are dealing with who are maybe susceptible to the CO2 levels in the blood, who are maybe not reaching that 25-second test that we mentioned earlier. What are I want to give the women listening some action items here. So what is the how? What is the breathing practice that someone who knows that she gets PMS symptoms in the luteal phase of her cycle, or someone like, myself and all of the Bettys that are listening that love to work out and maybe haven't even noticed whether their mouths are open during a strength training session or, a cardiovascular session. I have a couple of nuanced questions that I want to ask you there. But what are some of the breathing techniques? So I've heard of things like box breathing or even extending the exhale longer than the inhale. Are there ways that we want to think? Is there a breathing practice that you typically recommend? I know you mentioned slowing down the breathing or slowing down the rate, like your respiratory rate. But is there a cue, or are we counting inhale is half as long as the exhale, or anything like that?
Yeah, of course. I suppose the question to ask is, it's not just about the breath hold time. The breath hold time is an indicator. It's going to be normal that many of your listeners have low breath hold times. And the reason being is because society doesn't necessarily put attention on breathing, especially chronic hyperventilation, even though chronic hyperventilation is quite common. It's about 75% of the anxiety population. It's about between 30 and 60% of the asthma population. And it's about 10 to 20% of the general population. So if somebody has a low breath hold time, her breathing is likely to be a bit faster and harder. She's more likely to breathe in the upper chest. She's more likely to experience breathlessness, disproportionate breathlessness during physical exercise. She's more likely to be in an increased stress response, especially if it's culminating with quite a low breath hold time, because that would indicate that maybe there's, the autonomic nervous system is in an increased stress response. So how then would she change it? I wouldn't do box breathing. I wouldn't just focus on the speed of the exhalation. We want to improve our sensitivity to carbon dioxide. In other words, we want to reduce it. We want to improve our tolerance to CO2. The best way to improve tolerance to carbon dioxide is by breathing less air. And by breathing less air is not just about the respiratory rate. There can be a paradoxical situation that if I said to you, Stephanie, what I would like you to do is breathe 6 breaths per minute, and you start slowing down the respiratory rate, say from 18 breaths per minute down to 6 breaths per minute. Well, somebody who's breathing 18 breaths per minute, they're breathing that rate for a reason. It may be because of anxiety or panic disorder, or they have an increased sensitivity to carbon dioxide because something is driving that faster respiratory rate. Now, if you go from 18 breaths per minute down to 6 breaths per minute, it's going to be very uncomfortable for that person because there's so much of a gap there. And what will happen is that she will take bigger breaths, and the tidal volume could increase disproportionately. That actually could cause her to breathe even more air than what she was breathing before she started. And that in turn then is increasing her hyperventilation, and it's making worse the very thing that we're trying to make better. So what I would say to people is, don't overthink it. Don't count your breathing. Simply at a time that you're comfortable, experiment with this a little bit. And say, for example, you have 3 minutes to spare, 4 minutes to spare. You're sitting down, you're in a comfortable environment. Bring your attention out of your mind and onto your breath. You're feeling the slightly colder air coming into your nose and the slightly warmer air as it leaves your nose. And bring a feeling of relaxation throughout the body. And also encourage your breath in to soften. So as you're breathing in, you could either take a shorter breath in, so you're not taking the full normal breath in that you do. You're taking a shorter breath in or a really soft breath in. And then on the breath out, you're having such a relaxed and a slow and a gentle breath out. So the objective there is to slow down the respiratory rate, but not through counting, because again, you might have 10 women. 2 of them might be breathing 18 breaths per minute. 2 of them might be breathing 15 breaths per minute. 2 or 3 of them might be breathing 12 breaths per minute. So I can't give a measurement because what's going to work for one isn't going to work for the other. So all I would say is this is what got me into breathing. I sat down, I put one hand on my chest, one hand just above my navel, and I started really under-breathing. And I under-breathed to the point that I felt breathless. I under-breathed to the point that I felt that I was not getting enough air. Some people might describe it as being slightly suffocated. It's not to the point that it should be stressful. It's just gently softening and slowing down your breath to the point of air hunger, but you still have good control over your breathing. And within a few minutes, I had increased watery saliva in my mouth. I was feeling drowsy, and this was the biggest, my temperature in my hands increased. I always had cold hands and feet. I never realized that the temperature of my hands and feet were due to how I was breathing. And this is an experiment for anybody to practice, because if you can increase blood flow to your hands and feet, you know that you're not just increasing blood flow to your hands and feet. Right. Then we have to think of the wider thing here. Now, the increased watery saliva in the mouth is also interesting because, see, the thing about breathing less air, I teach about 25, 26 different breathing exercises. I could teach any breathing exercise under the sun because ultimately there's nothing to breathing. You've got a breath in, a breath out. That's it. I can speed it up. I can slow it down. I can breathe harder. I can breathe lighter. I can breathe higher. I can breathe lower. I can breathe nose. I can breathe mouth. I can put any combination of breathing exercise together. You could write 100 different breathing exercises depending on what you want to achieve with that person. So breathing in the face of it is relatively simple. And sometimes it's made complex, but it's not. But all I would say to people, if you want to find a breathing exercise that works, the best thing to do is dip your toe gently into the water. Don't go with the breathing exercise that necessarily get all of the attention, such as hyperventilation and long breath holds, because I'll tell you this, if you already have poor breathing, the last thing you want to be doing is adding an extra stress response on top of what you're already doing. Yes, hormetic stress is good. Physical exercise is a hormetic stress, but breathing is more powerful than physical exercise. If I had somebody hyperventilate, control hyperventilation for 30, 40 breaths and then do a long breath hold, I can lower their blood oxygen saturation down to 50%. I don't want to go there because that's a reduction of blood flow to the brain, but yet those are the breathing exercises that often get the attention. So what I would say is start off the stuff that's accessible. Whenever you're going for a walk, breathe in and out through the nose. Whenever you're doing your yoga, whenever you're doing your physical exercise, breathe in and out through your nose. And I'm sure you're going to ask me, well, what zones and what intensity? And I can go through all of that as well, because ultimately an adaptation has to take place. When you switch from mouth to nasal breathing, the air hunger is stronger when you do physical exercise. You're adding an extra load onto your breathing from both a biochemical dimension, because you have an increase of carbon dioxide in the lungs and blood, but also from a biomechanical dimension, because you're helping to strengthen the diaphragm. Now, if you think then, well, what does the diaphragm do? Is it all about respiration? No, it's not. It provides a stabilization of the spine. There's a relationship between the inner core. So, for example, it's not just about the abs. You've got the pelvic floor, you've got the diaphragm at the top. So, the diaphragm has a number of really important functions. And that's the biomechanical dimension. But yeah, coming back to your question, how might you reduce your sensitivity to carbon dioxide? How might you increase the length of your breath hold time? Start breathing in and out through your nose during rest, during physical exercise, and also during sleep. And this was a big one for me. Okay. So back in 1998, I came across breathing and I started breathing less air and my temperature in my hands increased. My nose was stuffy and I have a nose that's terrible. It's deviated septum. Everything is wrong with my nose.
Same. I have a deviated septum as well. Yep.
And the issue with that then is, of course, it increases your resistance to breathing and then it can increase sleep problems. Mm-hmm. But I just didn't have a deviated septum. I had chronic inflammation. And by holding my breath, I was able to decongest my nose. And it really made a difference. And that night then, I wore a nasal dilator across my nose and I taped my mouth closed. Now, in hindsight, it wasn't particularly the wisest thing to do, but I was kind of keen to start making progress with it. I would say, get your mouth closed during sleep, but don't necessarily cover the mouth, especially if you have moderate to severe sleep apnea, because it's not safe. But so, for example, we use a tape called MyoTape, and I'm not here just to give a plug, but it's if you're waking up with a dry mouth in the morning, you're not likely to wake up feeling refreshed, because when the mouth is open, the tongue is going to be in a low resting posture, and the tongue is more likely to go back into the airway. The lower jaw or the mandible is more likely to go back into the airway. Now, we already said that women's airways are narrower than men. Right. Now, that's not across the board. It is across the board, but you could have a man who's quite obese, and because he's increased fat pads on the throat and, sure, increased fat in the tongue, his airway is narrow, and then he has obstructive sleep apnea. But again, it comes back to, I'll keep going with reducing the sensitivity to carbon dioxide. Think about how you're breathing all of the time, but don't become obsessive about it. Pay attention to your breath. Try and identify when you're sighing frequently. Frequent sighing is not normal. Frequent sighing would indicate that you have air hunger, and you're having a frequent sigh. You're sighing frequently to alleviate that feeling of air hunger. But air hunger, or the sensation that you can't take a deep breath, that would imply that there's a breathing pattern disorder. So very often people don't tie that in. Now, I know Dr. Andy Huberman, he talks about the physiological sigh. I was going to say,
the physiological sighs right there. Yep.
It theoretically, it makes sense, but I've worked with 9,000 clients. This has been my job, and I'm not just theory, I'm practice. Yeah. And I often see people coming in, and it's the people who are coming in with the poorer breathing patterns, the people who are coming in with anxiety and panic disorder, they're already feeling very uncomfortable with their breathing, and that's why they're sighing frequently. Now, I will not give them the physiological sigh. And the reason being is because I want to improve their everyday breathing patterns. I want to reduce their chemosensitivity to carbon dioxide. I want to improve their breathing from a biomechanical point of view. I don't want to give them the physiological sigh, because that may plant an idea in their head that that's good to do. And then they do that on top of their already poor breathing patterns, and all it's going to do is make things worse. So again, there is a place for breathing, but what breathing exercise do you give to the person? And that's why I said, start off with the basic stuff. In and out through your nose all the time. Physical exercise with your mouth closed. If the air hunger is too much, just slow down the pace a bit. Give your body time to adapt. And keep telling your body and brain that you're safe. And how do we tell the brain we're safe? Slow down the speed of the exhalation. You don't have to take the full big breath. Just take a soft breath in and a really slow, relaxed and a gentle breath out. Because whenever you slow down the speed of the exhalation, you're stimulating the vagus nerve. You're telling the brain the body is safe.
Okay, I have 40 questions now. All right, so I'm so happy that you brought up the physiological side because that's essentially hyperventilation, right? It's two quick breaths followed by an exhale. But to your point, if we are already breathing incorrectly or we'll say less optimally, that is not going to be the long-term solution. It's almost like you're giving someone that's not you're not going to just physiological sigh 24 hours a day, right? You need to be able to learn how to breathe properly, which sort of leads into my next question, which is one of the things that I notice particularly with women because of society and culture. We're always holding our stomachs in, right? We walk somewhere, we don't allow that softness in the belly. And what I noticed in practice, I would get men who would have neck issues and shoulder issues, but by and large, the neck and shoulder issues that I would be caring for with my patients were female. And I think that part of that, and I would love your comment on this, is that inability to soften the belly, allow the diaphragmatic sort of expansion. And then when I would ask people to breathe, I would say, take a deep breath in, and they would do something like, so if you're watching on video, you'll see this, and I'll describe it on audio. They would do something like this, like take a deep breath in. So the shoulders would come up. So you're getting all these, the accessory like muscles of respiration in the neck. So you're getting the scalenes, the deep neck flexors, the sternocleidomastoid, and then you're getting the traps that are elevating and depressing the shoulders rather than taking a breath through the belly. So there's a couple different questions I have here, but the first is, how are we actually, so you've talked about the softness in the inhale, allowing for a nice long exhale. Can we also think about how to soften the belly a little bit to allow for the diaphragm to actually depress and allow, is there something to that as well, rather than for women in particular, sort of holding the corset, like, trying to hold the tummy in all the time and not allowing for that natural expansion?
I think it's important to start off with the basics. And if you look at a baby breed, or if you look at a young child breed, typically you will see that their lips are together, they're breathing in the neck through the nose, and you will see that they are breathing low. It doesn't have to be an infant. A cat can be a very good example. A cat is lying down on the rug, mouth is closed, and you'll typically see that their breathing is lower. And that's a deep breath. The cat isn't taking a full big breath. In other words, the cat is naturally deep breathing because the word deep just means far from the top, and deep doesn't mean big. So when people are often told take a deep breath, they often take this, what you described there, a fuller breath or a harder breath into the upper chest, but that's not a deep breath, that's a shallow breath. So when we think about the diaphragm, in the back part of the brainstem, a very primitive part of the brain, it connects the brain to the spinal cord. And housed in that is the respiratory center. And the respiratory center is detecting primarily carbon dioxide and blood pH. They are the primary drivers of breathing. Oxygen to a lesser extent, but oxygen only when oxygen levels drop by about 50%. So in other words, every breath that we are taking right now is not driven by oxygen. It's driven by carbon dioxide. And as carbon dioxide increases a little in the blood and blood pH drops, there's a signal sent from the brain stem to the diaphragm. And the diaphragm breathing muscle moves downwards. And the intercostal muscles, which are the meat between the ribs, pull out. Now, as the diaphragm moves downwards and the intercostal muscles pull out, it increases the volume of the thorax, the chest. And this in turn reduces the pressure inside the chest, which draws air into the lungs. So it's the movement of the diaphragm downwards which is drawing air into the lungs. It's not the air that's coming into the lungs that's pushing down the diaphragm. Now, of course, when the diaphragm moves downwards, you're going to have some movement to your side, some movement to your front, and some movement to your back. So you actually have movement on all 360. And it's really important, because the diaphragm is providing so many different functions. Like every breath that we take, the diaphragm is massaging the internal organs. There's also increased blood back to the heart. Lymphatic drainage, so the body's way of getting rid of getting rid of waste, say, from the body. The lymphatic system doesn't have a pump of its own, so it's reliant on the diaphragm. We have the mind-body connection in terms of the diaphragm to the brain, and there's a connection there. We have better gas exchange when we're breathing diaphragmatically. So I think when we have an understanding that the diaphragm and breathing low is really, really important, and even if you're watching your animal, just watch your animal breathe. And dogs, yes, they can mouth breathe, but invariably dogs are mainly nasal breathers. And now we get a sense of, yes, this is where we should be breathing into. Now, I find the best thing to do is to listen to a guided audio for relaxation. I put a few together from my own students 15 years ago, 2010. I started doing one because very often people feel, well, they can't relax. And if you have a guided audio with, say, music and in the background, and it's scripted specifically to bring you down into deep relaxation that you can just let go. And then with that, then there's breathing exercises that you can practice when you're in that relaxation. How do people let go? Now, of course, they could have a manual manipulation. Say, for example, a massage will be one aspect of doing it. Physical therapists can be very well trained in terms of helping to engage the diaphragm. It's not the most pleasant, but it can be very, very useful. But the other thing that I would say is, again, I'm going to come back to going for a walk with your mouth closed. And the reason being is the most accessible and simple thing that anybody can do. If we go for a walk with our mouth closed, we're naturally going to be breathing a bit fuller breaths because we need more air due to the physical exercise and the increased metabolic demands. We're also going to be breathing lower because we're breathing in and out through the nose. We naturally will have a better recruitment of the diaphragm just doing our physical exercise with the mouth closed, and even just bringing a feeling of relaxation to the body as we're doing that. So 3 ways. If I had a client and she's saying that she's a lot of tension, I would go through a little bit of the theory. What is the diaphragm doing? That it is normal that you're going to have a little bit of movement to the front, a little bit of movement to the sides, a little bit of movement to the back. I also say that because sometimes people get confused about belly breathing. And what they do is they put their hand on their belly, just above their navel. And as they breathe in, they're pushing their belly out. And as they breathe out, they're pulling their belly in. That may not be correct though, because you could be pushing and pulling your belly irrespective of your breathing patterns. So what I would like to do with my students is I have them put their hands on their sides. And as they breathe in, I gently ask them to guide their lower ribs outwards. So as they breathe in, can they feel the lower ribs just gently moving out? And as they breathe out, do they feel their lower ribs gently moving in? Because it takes intra-abdominal pressure to push the lower ribs outwards. And that in turn then is a good reflection of the stabilization of the spine. And I'm not sure how many women have lower back pain, but 50% of people with lower back pain have dysfunctional breathing. Now, you could ask, is it the lower back pain which has really messed up their breathing, which is possible, or is it the poor breathing patterns with reduced recruitment of the diaphragm and reduced stabilization of the spine feeding into the lower back pain? But in any event, it comes back to what we spoke about at the start. There's 3 dimensions to breathing. It's not just about the biomechanics, you have also the biochemical and the psychophysiological.
All right. So you said before you're probably going to ask me about zones with mouth
Yes.
and nasal, and I would like to make sure that I ask you that. It's like, oh no, he got one of my questions. Yeah. So I love to think about when I am strength training. Primarily, my mouth is closed. Zone 1, 2, mouth is closed. At what point? Maybe it's like a zone 5, like an all-out sprint, where the volume of I'll let you explain it. At what point, if any, there might not be, does it necessitate mouth breathing?
Yeah, of course. Like people are going to switch to mouth breathing when the air hunger gets too much. So some people will switch at zone 1 and zone 2. How many times have you looked out a car window, you see people walking down the sidewalks and they have their mouths open? They don't need to. They're not doing much physical exercise, and even they will be out of breath. And, that gives you a telltale sign. These people are breathing hard and fast with minimal physical exercise. They are in pretty poor shape from a breathing point of view. So it's air hunger that's the primary switcher from nose to mouth breathing. And that's going to be influenced by your breath hold time. So the breath hold time that we measured at the very, very beginning, how long can you comfortably hold your breath for after an exhalation? If it's down around 10 seconds, you're going to be breathless during physical exercise, disproportionately. If you're up around 25 seconds plus, you're much more efficient with your breathing. And it is a question of how much physical exercise can you do with your breath? And a well-trained athlete, they can do physical exercise with reduced ventilation in the main. Now, some of them, of course, push through it. But generally, if you had a really top-class swimmer, these guys, these girls, they can do a 50-meter length of a pool on one breath. You know, that takes a special training. That's reduced chemosensitivity to carbon dioxide. So Bolt score is one. The second one is the size of your nasal airway, and this is race determined, and it also depends on trauma that we might have had, or even if, for example, we had our mouth open as a kid, and because the mouth is open as a child, the tongue isn't in the roof of the mouth, so then we have a high narrow palate and a narrow facial structure, and the high narrow palate then is pushing into the septum, and the septum then is deviated. So the line that divides one side of the nose to the other is off, and that in turn then can reduce airflow. So if we have a smaller nose or a deviated septum, that in turn is going to make nasal breathing during exercise more difficult. I use a nasal dilator. I have to. A nasal dilator is something that's worn. The one I wear is a Roman. It's inside the nose and it flares open the nostrils, and it's based on the Cottle maneuver. You can buy them in any chemist. You can buy them at a pharmacy, drugstore. You can buy them Amazon. Nasal dilators help to open up the nose for easier breathing. The third thing is your adaptations. If you just start off today doing physical exercise with your mouth closed, yes, air hunger is stronger. But if you continue doing your physical exercise with mouth closed, air hunger diminishes. Now, this is where training kicks in. Your diaphragm is getting stronger. Your diaphragm is functioning better. Your sensitivity to carbon dioxide is lowering. Now you can do physical exercise with less ventilation. And there's an economical saving here because every breath consumes energy. It's not just that, the respiratory system is all about taking air into the lungs. The respiratory system needs its own oxygen because it's a muscle. Like the diaphragm is a fairly significant muscle, and it needs its own blood flow, its own oxygen. And if we're working that diaphragm especially hard, we could be prone to diaphragm fatigue. And if the diaphragm gets tired, if the respiratory system gets tired, blood is stolen from the legs to feed the diaphragm. So you could think of an athlete going down the track, race track, and the next thing is their legs start going from under them. Is that due to a buildup of hydrogen ion, or is that due to diaphragm fatigue? And it could be both. So those three factors. One is your Bolt score. What's your sensitivity to carbon dioxide? Number 2 is your nasal airway size. Number 3 is your adaptation to nasal breathing. And I would say not necessarily to go by heart rate when you're doing physical exercise. It's more so the perceived effort. You should have good control over your breathing and keep ramping up the intensity at which you can control your breathing. But if you find that it becomes just a little bit too much for you and your breathing is a little bit uncomfortable, then just step back a little bit and be patient with it. Now, of course, if somebody here is a pro athlete or take their physical exercise very seriously, they're going to say, there's no way I'm going to do my training with my mouth closed. Listen, do some of your training. Do the zone 1, zone 2 stuff only with your mouth closed. You can even do zone 3. Most people, will be able to go beyond zone 2. But certainly after a few weeks, they'll be able to go into zone 3 with their mouth closed. Yeah.
So diaphragm, okay, so I have, again, lots of questions. This is what happens when my podcast brain is turned on. I'm like, I have 400 questions. So diaphragmatic breathing, I remember when I was taking a lot of functional neurology courses when I was still in private practice. And I remember one of the instructors saying, one of the things that happens when someone, if someone goes into like acute respiratory distress is that they literally flip them onto their stomach to help to engage the diaphragm, like ARDS, acute respiratory distress syndrome. The standard of care is to flip the patient onto their stomach so that they can start breathing, or they're at least breathing against some resistance for the diaphragm. So if one of the objectives is to improve diaphragmatic breathing and, of course, to strengthen the integrity of the diaphragm, would sleeping on or spending some time on your stomach be something that we might consider, or putting a weight literally over the abdomen and breathing against that as a way to train it? The diaphragm is this, umbrella-like structure, as you said, that's 3-dimensional. It expands in the coronal plane, the transverse plane, and the frontal plane. And so is there ways that we can think about improving the integrity of the diaphragm. And it's not like a quadricep where you're just like, I'm going to sit on the leg extension machine or I'm going to do some goblet squats or something. Is there a way that we can think about improving the strength of the diaphragm?
Yeah, I think switching from mouth to nose breathing would number one. For example, I always ask my students to look down at their chest. You can try it there. If you look down at your chest and then take a breath through your mouth. So just by mouth breathing, you'll typically see that you're engaging more of the upper chest and there's reduced recruitment of the diaphragm.
Mm-hmm.
And this again comes back to our walking with the mouth closed. Because we typically will engage more of the diaphragm because the air is naturally blown into the lower regions of the lungs. And also when you're breathing in and out through your nose and you're harnessing nasal nitric oxide, it's helping to redistribute the blood throughout the lungs. I think being conscious of it, we use a belt, Buteco belt, and we have people wear it around their midriff. Now, with some of them, I actually have it wear across their chest. Because what I do is I have them put a little bit of pressure on their chest to help encourage their breathing to go lower. And so for some people, we have them wear it on their chest. For some people, we will have them wear it specifically in the lower ribs, and it encompasses the diaphragm. And the objective then is as they breathe in, that they should be pushing against the belt. So it's more proprioceptive in terms of people get a better sense of where they should be breathing into. And I remember I had somebody with chronic heart failure and she was just here as a student. And her blood oxygen saturation while she was walking was dropping down to 92%. And I was saying, this is not good,
God.
you know. And in any case, there's a poor gas exchange that was taking place there. And I remember the work of an Italian doctor, Bernardi, and he'd also worked with a lot of people with chronic heart failure, and I haven't. You know, this just happened to be one individual. And I said to her, I put the belt on her. And I said to her, now, what I would like you to do is gently walk. I had pulse oximeter on her, so I was monitoring her pulse oximetry. And I said, I would like you to slow down your respiratory rate to 6 breaths per minute. Maybe we start off at 12, then down to 10, just gently slowing it down. And I asked her to breathe nose, to breathe slow and to breathe low. And during that time, within a couple of minutes, we were able to bring her blood oxygen saturation from 92% up to about 95, 96%. And that's normal. That's what you would expect with that. So just by having her breathe in and out through the nose, even when she was doing physical exercise, directing her attention to the lower ribs. Now, I did have the belt on her, so at least that made it a bit easier for her to kind of sense it. But I find one of the easier breathing exercises, there's a few that we use in terms of helping to engage the diaphragm. One is lying on the back with knees bent. By the way, Stephanie, I have an app with everything that's free in this. Everything is free. I spent 2 years putting an app together, and then I decided, people were saying, put a subscription on. I says, no. I said, we're going to put it out for free. And I don't know how many thousands, there's tens of thousands of people use it. And it's got about 100 different videos of all different breathing exercises. I think there's a program for female breathing, if I can remember correctly.
But give a plug to the app. We'll make sure it's in the show notes, but what's the name of it?
It's called Oxygen Advantage.
Okay.
Now, when you download it, it does ask for your email address. That's not for marketing. That's just so that you can access it because it's specific for you. Mm-hmm. And it asks you your Bolt score. It also asks you, like, what would you like to achieve? Is it for the office? Is it for sports? Is it for sleep or anxiety or asthma? So there's a range of different breathing exercises there to train the diaphragm as well. Lying on the back is a very normal one. The semi-supine position with the knees bent. Just having a little bit of a weight just in terms of between the navel and the ribs. And as you breathe in, that you're just gently guiding the buck upwards, for example, if it's a buck. And as you breathe out, the buck is just gently falling. You could be doing it standing. I often have my students stand while they're doing it to get a sense, look down at where the breathing is. I have them walk while doing it because I want to make people more efficient as well during physical exercise. You know, diaphragm breathing is all about, it's not just about breathing, it's about movement as well. There was an interesting study that was done by physical therapy, and they looked at the connection between those with dysfunctional breathing patterns and dysfunctional breathing, say from a biomechanical point of view. In other words, what you spoke about earlier, that people are breathing more in the upper chest and reduced recruitment of the diaphragm, that those individuals were more prone to injury because they had dysfunctional movement. And it went to the point that the researchers said that there was a connection. Dysfunctional breathing and dysfunctional movement go together. And if we want to have functional movement, we have to have functional breathing. And it comes down to the role of the diaphragm, providing that support for the spine.
And that I would also think too, when we see men and women in the gym wearing belts, like lifting belts, I would assume that a lot of that, especially when you're doing things like deadlifts or even squats, like there's a lot of intra-abdominal pressure, especially at the, the long length when, you're in the hole, let's say with the squat, or you're completely hip hinged over during a deadlift. That would be the advantage of the belt. I think a lot of people maybe erroneously think that a belt is going to give you some type of lumbar support. But really, my understanding, and you feel free to redirect me here, is that the whole point of that is to actually engage the diaphragm, right? It's to make sure that that you are expanding and you are touching and you are making contact with that belt in all the planes in order to do that lift properly. And I think that a lot of women in particular, I actually want to do a bit of a post about this. It's like your stomach is going to expand when you lift, especially if you're doing it
Totally.
correctly during a deadlift or during a squat. Like your waist is not going to be it's not going to be, you can't suck in your stomach when you're doing a lift like this. Your stomach has, by definition, it has to expand. You have to allow for that diaphragmatic expansion, for that negative air, correct?
Yeah. And like the other thing I would say is nobody will notice it. Sometimes we
Yeah.
get so
No,
hung
that's the
up
other
on it.
thing. Yeah.
The
Yeah.
diaphragm during rest is only moving down by about 2 or 3 centimeters.
Yeah.
It doesn't move down by all that much. Now, during intense exercise, it could be 10, 15 centimeters. And as the diaphragm is moving downwards, you're getting that movement to the sides, to the front, to the back. Now, interesting about the weight belts, but I think that's a good point that you made, that yes, it can be bringing attention to the person. Because typically a weightlifter, just as they're about to take the weight, they're breathing in and they're holding their breath. So there's going to be a negative pressure in the chest because they've breathed it in. The diaphragm has moved downwards. Now it's almost like the abdomen is like a pneumatic balloon and it's providing that stabilization. So as they're taking the weight, it's during an inspiration. And I think, yeah, you could have a good point there. Yeah.
And the other thing I've noticed just with my own training is especially when I'm reaching failure. So I'm not quite at failure yet, but there's a lot of, metabolic debris that's accumulating in the muscle, whether it doesn't matter what muscle, it could be legs, could be shoulders, could be whatever, back. And in order for we know that the research is relatively clear, especially if the goal is hypertrophy, is that you want to be approximating failure. You can certainly go to failure if you like, but as long as you are in that sort of getting really close to failure, you are going to stimulate muscle hypertrophy. And what I have found is that when I know I'm approaching, like it's like an 8 out of 10, it's a 9 out of 10, it's a 10 out of 10 in terms of intensity, if I can just take a pause and take a couple of breaths, diaphragmatic breaths, deep breaths, I can actually continue. I can actually punch out 1 or 2 or 3 more repetitions on that working set. And that makes a big difference when you are trying to grow muscle, because it is really not the first 5 or 6 repetitions that count. It's really the last ones as you are getting closer to failure. And you can utilize the breath as a way to, let's say, clear out some of the debris, or just, that press pause technique where you press and then you take a pause and you keep going. So the longer that you can stay in that close to failure zone, let's say, the more muscle growth, like the bigger stimulus you're going to get to the musculoskeletal system. And I think that that's, at least for my goals and for the goals of a lot of the listeners in this audience, I think is important as well, that the breath can be a very powerful tool in continuing to stay in that uncomfortable, you're not quite at failure yet, but you're in that uncomfortable zone approaching failure, and you can use the breath to attune that.
And it may be also that your brain is weighing up what's going on in the body via your breathing. We know that the brain is spying on the breath. Stanford researchers found that back out in 2017. So if, for example, you're pushing yourself to the limit, your breathing is going to be changed as a result of it, and your brain is picking up on that. And then you're taking a pause and you're just having a few regular breaths, and your brain is interpreting, well, everything is okay. Let's keep going. So there could be something else. So, the human body is very complex and it's very interesting.
I wanted to shift to for a moment and talk about perimenopause and menopause. Of course, there are a lot of changes that happen to a woman's body in perimenopause, but you've spoken about this idea that as estrogen and progesterone levels are lower in postmenopausal women, then that can also change that chemoreflex drive to breathe. And so this is part of the reason we were talking about sleep and we were talking about nasal breathing and versus mouth breathing. This is maybe potentially why you see a lot of women in menopause start to snore, right? Or we start to see more dysregulated sleep. And of course, hormone replacement therapy can be a part of that. Talk to us a little bit about the changes that perimenopausal, menopausal women experience and how that might affect sleep, how that might affect our sensitivity to CO2 potentially. Tell us a little bit about that.
Sure. So perimenopause and postmenopause, sleep disorder breathing increases by about 200% in females. And typically, when I talk about sleep disorder breathing, you're going to include snoring, you're going to include upper airway resistance syndrome, you're going to include obstructive sleep apnea. Snoring is turbulent airflow, and it's a combination of a narrow airway, but not just a narrow airway. If, for example, you're breathing a bit harder and a bit faster, it's going to increase resistance to breathing. And if the resistance is sufficient that airflow becomes turbulent, it creates the sound of a snoring. There's two forms of snoring. One is for snoring through the mouth. So this is especially when the palate right at the back of the roof of the mouth, that's vibrating in accordance with airflow. And we tend to mouth breathe more when we get older. So mouth snoring, and I'm not sure if the mic is going to pick up on this, but mouth snoring goes a little bit like this. So I'm not sure if you picked up on that.
Oh, yes, I can hear that.
Throaty sound.
Yes.
And you can stop mouth snoring once you get your mouth closed during sleep. So, if you were to try and mouth snore now, you have to open up your mouth to snore. But if you close your mouth, you can't mouth snore. And mouth snoring is probably the more common of snoring. Nasal snoring is when there's turbulent airflow in the nasopharynx where the nose is meeting the throat and the sound is more nasally and it goes like this. So in order to help reduce nasal snoring, it would be a good idea to open up the nose. And that could be, you could use a nasal dilator, which is very important, but also to change your breathing patterns. Practice breathing in and out through your nose all the time. That's not just my kind of thinking. Dr. Christian Guilleminault is considered to be the founding father of sleep medicine. He passed on in 2019. It was he that coined the phrase obstructive sleep apnea, and he talked about the critical importance of maintaining nasal breathing during rest and during sleep, in pediatrics and also in the adult population. And this is often forgotten about during sleep. So what I would say is that start off with nasal breathing during sleep. So that's snoring.
Mouth taping. We do that with mouth tape. Like
mouth taping, yes, but not to, again, there is always a risk by covering them out. And I think it will never become mainstream as long as people are just taping right across their mouth. Because I work with children a lot, I had to come up with a way of helping to get them breathing in and out through their nose, starting off during the day and then during sleep. And I developed a tape called myotape. And it's basically a tape that surrounds the mouth, pulling the lips together. So if, for example, somebody needs to mouth puff, they can do that because they have to be able to do that. If air has to leave the body, it has to leave the body whatever way it can. And if it has to be through the mouth, it has to be through the mouth. Mouth puffing is when the person is breathing in through the nose and out through the mouth. So then if we look at upper airway resistance syndrome, say, for example, you have a female and she has insomnia, which is much more common in women than men. Or she has panic disorder, anxiety, depression, fibromyalgia. And she knows there's something not quite right. And then she does a sleep study. And in the morning, she gets her result, and her AHI, which is a measurement of the number of times that she has apneas during sleep per hour, or hypopneas. And an apnea is when she stops breathing for 10 seconds or more. And a hypopnea is when there's a reduction in the flow of breathing by about 30% or more. But her figure could be anything between 2 and 5 events per hour. And that would indicate that she doesn't have sleep apnea. But the research shows that if a female has an AHI between 2 and 5 events per hour, it's equivalent to a man having an AHI between 10 and 15 events per hour.
Oh, wow.
Now, the problem with that is that the sleep doctor is going to say there's nothing wrong with her, but there is. And possibly she has upper airway resistance syndrome. And upper airway resistance syndrome, very often these females are slender, they're slim, they don't typically meet the criteria that you would expect for, say, somebody with sleep disorders. Typically
You
it's more
expect an
men.
obese, you expect someone
Typically,
that's
yes,
obese or something. Yeah, yeah.
correct. And male and over 50. Those typically are the three things that, the hallmarks for it. So I think there's a lot of women that are falling between the cracks of sleep medicine. And it needs to, the symptoms of women, the symptoms that women have as a result of poor sleep are different to the symptoms that men have. That's one aspect of it. Number two, their airways seem to conduct differently. Upper airway resistance syndrome would imply that there's a resistance to their breathing during sleep. In other words, it takes more effort for her to breathe because there's a narrowing of the airway. And the women who may be more susceptible to that are women with a high narrow palate or women who had extractions of teeth. So, or due to orthodontic work, if they had their molars extracted or other teeth extracted, that can be quite common because, again, if we have teeth extracted, it can result in a smaller jaw. If the jaw is smaller, the maxilla, there's not enough room for the tongue and the roof of the mouth. And if there's not enough room for the tongue and the roof of the mouth, it can encroach the airways. So I think women need to think that even if she's done a sleep study, and even if her results come back and she only has 2 events per hour, and I put in inverted commas only, it doesn't mean that her sleep is not impacting the way she is breathing during her sleep. Now, obstructive sleep apnea increases, of course, in postmenopause and 200 to 300%. So it's quite a significant increase. Why might that be? It's thought that progesterone actually protects the airway from collapsing. So younger females, when they have increased progesterone, that it's helping to stabilize the airway. But postmenopause, when progesterone production levels off, that the airway is more vulnerable to collapse. Now, another aspect will be distribution of body fat. So we tend to put fat around the belly, and the problem with belly fat is that it impinges the movement of the diaphragm. And the diaphragm breathing muscle is mechanically linked with the upper airway dilator muscles in the throat, which are designed to help keep that airway open. But we also put fat on the throat. And whenever there's increased fat pads or fat deposits on the throat, that in turn then narrows the airway. And also the tongue can get fatter. And if the tongue gets fatter, it occupies more space in the mouth. And then, of course, if she's mouth breathing and if she's faster breathing and harder breathing. So you have a lot going on that's feeding into sleep. I think there's a huge connection between our functional breathing patterns, our everyday breathing and how it feeds into sleep.
Mm-hmm.
I just completed writing a 100,000 word book on it, and I submitted it to the publisher yesterday. And it's looking at the whole aspect of how we're breathing during the day, correct tongue resting posture, breathing in and out through the nose, what we can do to help improve our breathing. Because if we have faulty breathing patterns, it doesn't just correct itself during sleep. Now, let's look at insomnia, because that is really, really prevalent. Insomnia can manifest a number of ways. Number one is difficulty falling asleep. That's very often related to hyperarousal. The mind doesn't switch off. You're twisting and turning, you're running all of these things through the head. I really feel it's important for people to spend some time in their normal everyday life getting out of their head, bringing their attention into their body, bringing their attention onto their breath, bringing their attention into present moment awareness. This isn't something that needs to be done in a formal setting. You don't need special clothes. You don't need lotus position. You don't need any of the ums, ahs, or whatever people do when they're doing this. Sometimes I feel that the simple tools to get out of our head have been communicated in a way that they put everybody off. I am fortunate enough. I get into breathing, and I learned the ability to quiet my mind 26 years ago or 25 years ago. I spent half my life stuck in my head, and I spent the latter half of my life with some degree of control over thinking. And I have been able to reduce my thought activity by about 30%, 40%. Now, there's a tremendous skill in that, and it's so simple. You start off with your breath. You're going for your walk. Don't just go for your walk ruminating in thought. Don't just go down to the beach or into a beautiful area or into a park and sit on the bench and sit there and your mind is just going from one thought to another to another. You might as well not be there. You're sitting there in body, but your attention is not there. And we as human beings, we spend so much of our life that we are doing one thing, but our attention is elsewhere. To the fact that 50% of the time, our mind is wandering. Now, if our attention is wandering so much during the day, and if we are thinking so much during the day, how are we going to switch off the mind for sleep?
Right.
And this is where we bring it into our normal everyday life. So, in terms of falling asleep easier, I think it's important that we reduce the hyperarousal, that we don't expose ourselves to information overload because there's so much information. I have no social media apps on my phone. Genuinely. I have no Facebook. I have no Instagram. I've no LinkedIn. Now, I'm fortunate enough I have staff, but those staff work on those accounts because, of course, it's about putting out information. But I would say to people, be very selective with your social media. It's designed to capture your attention. It's very non-deep learning. Something like a podcast, I do listen to podcasts because they're long forms, and that holds your attention there. But if you see a lot of the information on, say, TikTok or something, it's just one thing after another. And it's almost training our brain to be so scattered to hold our attention on one thing for 1 or 2 brief seconds. We get bored, we move on again. And now all we're doing is training our brain to flit from one thing to another, to another, to another, to another. And we're training our brain.
Distraction. Yeah, you're training
totally.
Distraction.
Absolutely. Yeah. And that has a role to play in sleep. So I would say, yeah, sleep hygiene, people talk about it. The bedroom should be cool, it should be dark, it should be airy, all of that stuff, it should be silent. That's all good stuff, Expose yourself to daylight in the morning, try and avoid bright lights in the evening. But the elephant in the room is our state of mind and the autonomic nervous system. And with insomnia or low arousal threshold, if we wake up quite easily, the autonomic nervous system is in an increased stress response. And I think, Stephanie, we need to be easy on ourselves. Society has this thing about driving us and driving us hard. And if you think like 50, I'm 51.
We internalize it.
We do.
And then we hear those, and then we say, that is how I must show up in the world in order to be valuable.
Totally. Yeah. I think it's really important to go easy on ourselves, at least take some time out. And I didn't do it for years. I missed physical exercise because I was so involved with work. I felt guilty about it because I felt guilty about taking time off myself. And then I got sick of it. And I said, listen, I have to do an hour of physical exercise every morning. 1 hour. I'm spending 8 hours in work, 9 hours a day in work. Surely I can give myself 1 hour. And once I made that commitment, and it kind of took me a while just to get into that, but I said, that's it. I have to do it. I can't be just surrendering all of my attention elsewhere. But I know that it's so easy to fall into that trap. And the other thing about stress is there's a tendency then to be drinking alcohol. And the problem with alcohol is it totally messes up sleep. It totally messes up the mind. And that feeds into everything else. And, there's a societal thing there as well that it's good. You're stressed, take a couple of drinks to relax. No. If you're stressed, it's not about taking a couple of drinks to relax. We need deep sleep to relax. And we need balance of the autonomic nervous system. And the one thing about the breath is that the breath is a gateway to the nervous system. Because whenever we breathe in and out through the nose, or we breathe soft, we breathe light, we breathe slow, you don't have to count your breaths. Slow down your breath relative to how you breathe, especially slowing down the speed of the exhalation. We then are telling the brain that we are safe. And that's what the brain wants. The primary purpose of the brain, the primary function of the brain is to ensure survival of the body. How do we communicate to the brain that we are safe? We can use the breath. And it's not about breathing fast and breathing hard and breathing out and breathing upper chest, because all that's doing is telling the brain that we're under threat. Now, how about if we're breathing like that all the time? What's that going to do to the autonomic nervous system? And of course, that impacts our sleep. Our sleep quality is poor. And if we have poor sleep quality, we're in an increased stress response, which carries into the day. So that increased sympathetic drive during the day then follows us into the next night's sleep. And also we have a tendency for rumination of the mind. So I think we can never isolate the breath, the mind, and sleep. They're all just one triangle, and each one is feeding into the other. Each part of it is feeding into the other.
And I had questions about osteoporosis and osteopenia and the musculoskeletal syndrome of menopause and joint stiffness. And I think that you've actually covered it in the stress response. I've said many, many times on this show and, when I'm speaking public, on stages, it's like for women in perimenopause and menopause, your primary goal is to master stress, because there's good stress and bad stress. So not all stress is, created equally. Exercise is a stress, but it helps, adaptation. Maybe we can even categorize decreasing your respiratory rate is a eustress, right? Is a good type of stress that promotes healthy adaptation over the long run. And I think if we can begin to balance out the stress physiology or the sympathetic nervous system with regular activation of the parasympathetic nervous system, I think some of these specific mechanistic questions around, hey, how does, osteoporosis relate to the breath, is like, well, it's decreased, rib movement, and all of these different things can actually be related to stress, right? Joint pain, adhesions, anxiety, weight gain, hair and skin, like all of these different things. I often talk about creatine as an essential supplement for women. I'm like, what about, doesn't it make your hair fall out? Because there's this one study, 20 years ago in men, did not show statistically significant difference, but there was one group where they saw an increase in DHT. And I often say, hey, creatine helps with recovery. And you could make the argument, it's not a direct claim, but creatine, because it helps in recovery, helps you maintain your hair, because your hair falls out when you're really stressed. And so I think we can make the same claim with breath. Breath helps when we are breathing optimally and in the right way, and we are activating our parasympathetic nervous system, we are now optimizing recovery and our stress response to the demands of our life. And so all of these other specific questions that I had on the docket to ask you today around osteoporosis and rib cage and joint pain and all of that, I think can be wrapped up in what you just said. And I think it's very important to hear, and maybe women need to hear it a lot of different ways, but it is so profound to be able to have a window into the nervous system through the breath, and to be able to manipulate that in whatever ways is necessary for you in that moment.
I think it's huge. I think it's a really important tool. You go to events and it can be very overwhelming in terms of all of the different things that are being offered to you. Mm-hmm. And the breath is there. It's free.
It's always
simple.
There. Yeah.
It's always there. And
wherever you go, there it is.
And if you have a basic understanding of it, you have it for the rest of your life. And I did the number of times that it's come to my rescue. And the other aspect is that going into a challenging situation, the fact that I know I have breathing to fall back on takes the nerves, especially if it's public speaking and it could be large groups of people. I've done, one event was 400 people I spoke to for 7 hours without slides. So I had a break for 15 minutes every an hour and a half. But I was able to do it, and every 15 minutes that I had a break, I took time out to recover. I closed my eyes, I directed my attention inwards, and I used it as a rest and reset. And, there's something really about giving ourselves some attention and telling the brain that everything is okay. I don't think we do it enough. And all we have to do is, well, how might we do that? I think sleep is really, really important. And like I was going to, in terms of insomnia, waking up at 3:00 in the morning, there can be a pressure then to fall asleep. And it's very common. 30% of people have insomnia, 10% have it chronically, more women experience it than not. I listen to an audio. If I wake up at 3:00 in the morning, instead of using breathing to try and get me back to sleep, I want to hand the problem over to something else. And I simply listen to a guided audio, and that brings me back into relaxation. And it's breathing. It's guided audio breathing, brings me back into relaxation, tells the brain I'm safe, and then I can fall off asleep again. So yeah, they're very useful tools, Stephanie. I think that's what we need in today's day and age.
Well, we will definitely link to the Oxygen Advantage app. Where else would you like to direct people if they want to find out more about you and your work?
We have a huge amount of resources that are free on YouTube. The guided audios that I spoke about are all there. And
Are you
you'll also
narrating
get,
them? Are you narrating? Because
I
I love the
narrate,
way you
yes.
speak. You do.
Great.
Yes.
Thanks. Thanks.
Okay.
Right. Yeah, sometimes I've got one for insomnia. There's one for kids taking exams. There's one for perfectionist tendencies, and they're all on YouTube. You'll if you or they're on Spotify as well. What else is there? The app is there. I've got 11 books. I've got a new sleep book coming out in June of 2025, and yeah, I think you'll find. So the website is oxygenadvantage.com. That's kind of more fitness and performance. And then the website for health is the buteycoclinic.com. And that's more asthma, sleep issues, and anxiety, panic disorder, etc.
Well, let's get you back on the show for your next book. I would love to explore some of the concepts. You just said that you put it in the manuscript yesterday, so
Sure.
would love to have you in for a part two. Thank you so much. I think this is going to be so helpful to the women that are listening, and I think that there's not enough conversations like this where we are actually parsing out women and breathing and looking at some of the even though it's sparse, the data that's there and extracting that into clinical, applications in everyday life. So I thank you so much for your time, your attention, and your focus today.
Pleasure. Thank you so much. Great to talk. Thank you, Stephanie.
All right, welcome to the after party or the after show comments where I tell you how I really feel. First of all, I know that we talked about a lot of important things, but that man could be reading me the phone book. I just love the way he talks. And I don't know if you caught it right at the end. I was like, so on the app, do you happen to be the person narrating? Because man, what a beautiful accent, like chef's kiss. Love it. Very well suited for something that is going to help bring you into parasympathetic. So favorite parts of the conversation and things that I learned, things that were aha moments for me. One is that women can be hyperventilating through the menstrual cycle, and this can be one of the direct corollaries to some of the symptoms that we experience as menstruating women, whether you're in perimenopause or not. Some of the mood and anxiety and sleep changes that can happen can be related to, and often are related to, the breath and carbon dioxide intolerance. I thought that that was very, very cool. And I loved the test that he did. And I have to admit, as soon as I finish recording this, I am going to do that test on myself and see if I can hit that 25-second mark without needing to take a big gasp of air. And if I suspect that I'm probably going to hit it right around, it's going to be either like just before or just after. In either case, I'm going to be thinking about slowing down my breathing. And that was the other big piece that I learned too, was I was asking him at one point in the show, like, hey, do you like box breathing? Do you like, 4 count in, 4 count? And he's like, I don't recommend any of that. I just literally recommend that you slow down your breath. And I thought that that was so simple in its application, but also elegant as well. Because so often in the world of health, we're like, you need to be having 25 grams of fiber every day, or you need to be having this like X amount, and not titrating for size, not titrating for fitness, not titrating for age, right? Like not taking those variables into account. And, he said, for some people, you'll be able to keep your mouth closed in zone 3. And in others, you got to learn how to keep your mouth closed when you're walking. And so I loved that idea of just slowing down the respiratory rate to whatever it is right now, to, just a little bit slower. And he mentioned a couple times like 6 breaths a minute. And I'm, again, as soon as we're done recording, the little Miss Tester, I'm going to go and see where I am with that. My wearables usually clock me in at something like 11 or 12 breaths a minute. So one of my goals is going to be how can I get that maybe sub 10? That's going to be my own little personal goal. And I liked the conversation around perimenopause. I had a ton of questions for him that I think he actually summed up really nicely with this idea that breath can really help to augment our parasympathetics and our stress response. I had all these questions about joint health and the musculoskeletal syndrome of menopause and osteoporosis and rib cage function and all this. And he was like, All that is really important, and we just really have to manage our stress, and we have to be nicer to ourselves. And I think that there was really no better way to finish off the conversation with a reminder that the stress response is the thing. It is the key. It is the key to unlocking a joyous experience on this earth, of which we have limited time. So for me, I really love that. I hope that you found that useful as well. Leave me your comments and your thoughts. I read all of them, the good, the bad, the ugly. You leave me a terrible review, I am going to sit in a corner and cry. No, maybe I won't do that, but I will definitely read it. And if you leave me a positive one, I will also be reading that as well and continue on. And it also makes us know, myself and my team who produce this show, that this is making its way into your life and providing some value in the small way that it can. So if you feel like this podcast is worthy of a 5-star review on Apple, or even a review, even better, on Apple or Spotify or wherever you're listening, we would very much greatly appreciate it. So until then, I bid you adieu. We'll see you next time.